So much.
Appreciate it.
So I'm going to take a little different take on this as a physician. I will say that I actually do have a real estate license, and that's how I know Patricia Long. And I actually got a real estate license on the advice of my tax accountant because I was supposed to be starting to buy investment property. I need to start doing that, but I keep up my real estate license, and it's always good to know something else besides taking care of patients every day. And I will add, I am a graduate of the Howard University College of Medicine, so I always like to shout that out. But as far as my take on things, it's all about choices with your health, just like anything else that the panelists are going to talk about. And from my perspective, it actually really can come down to it's all about food choices. Despite the fact that it takes money to buy food, you can still make healthier food choices, improve what you're eating. And so if you don't mind, I'm going to give you a reference that you can look up on your phone. It's from the American Heart Association. It's an article that was published on their website March 27, 2020. It's entitled, "Eating Well Can Benefit Both Your Health and Your Bank Account." Mm-hmm. Eating well can benefit both your health and bank account. And I tested it out this morning. If you type that in, that should be the first thing that comes up. So the issue is it really more expensive to eat healthier as often as you hear? Because people tell me all the time, it costs too much to eat healthy. However, in one article I reviewed, it was documented that if you look at the food cost per calorie, unhealthy food costs less. However, if you look at food costs per typical portion, many healthy foods are less expensive than unhealthy foods. And furthermore, if you're looking to improve your health, you'll get more for your money when you consider the cost per nutrient value of your food choices. And then, in general, overall, based on what I'm about to say, it is healthier and less expensive, obviously, to make healthier food choices. And exercise is free.
Right? Right?
So I always tell my patients, food is medicine, so you can choose to eat good food and good medicine, or you can choose to eat bad medicine. It still comes down to choices. And so you still have to plan your time. So you can plan your time to eat healthy, make food choices that are healthy, just like you plan to do everything else in your everyday lives. And you have to put exercise in that as well. Unplanned purchases increase a grocery bill by 10% in one citation I read. So let's talk about money, since we're talking about money, and the cost that you can incur if you don't pay attention to your health and what you're eating. So how much does the average American spend on fast food annually? From the numbers that I saw, it ranged between $1,200 and $2,500 per year. I think that's low. A person with a poor diet can spend up to an extra $8,900 per year on health care costs. That came from the National Institutes of Health citation. Now, I didn't have to look this up. I don't have a reference or a citation for this statement I'm drawing on 27 plus years of practicing clinical medicine. Many diseases are diet related and or are exacerbated by making unhealthy food choices. So, what are your individual personal costs of obesity, or for that matter, having a poor diet, having chronic medical conditions, and especially having uncontrolled chronic medical conditions, medical issues, or poor health? What you will get is increase in personal health care costs arising from these conditions, including obesity, diabetes, heart disease, certain cancers, high blood pressure, high cholesterol, prescription drug costs, bariatric surgery, complications from surgery, which cost more when you have these conditions, being in a hospital longer if you have surgery, complications of all those conditions, having to see the doctor more lab tests, more diagnostic testing, having to see more specialists, paying out-of-pocket fees for stuff that is not covered by your health insurance, longer recovery time after surgery, less recovery if you need CPR resuscitation. If you're unhealthy or obese, you're less likely to be able to be resuscitated. You didn't think about that. So, indirect costs for poor health, chronic medical conditions, like decreased productivity and absenteeism at work, disability, unemployment, reduced quality of life, including decreased participation, decreased enjoyment in life. I can't go here, I can't travel here. And then obviously all of this leads to stress, depression, anxiety. And then there's also that potential of job discrimination and stigma. And because of these work-related issues, and all this stuff bleeds into your doctor's visit, there's a consequence of obviously lower wages, reduced earnings, that's money, especially in women. Higher insurance premiums due to medical conditions. So with respect to the title of my book, How to Help Your Doctor Help You, first, pick a doctor. A lot of people walk around and do not have a primary care doctor. Be an engaged, active, not passive partner in your health care. It pays to eat healthy and have better health.
And before we go on to the next speaker, and these things are cumulative, meaning
Yes,
the
sir.
earlier that you start this,